Hi, it's Dr. Mandy Reese with Reese's Pieces Diabetes. Thanks for joining me today. You may be wondering, as a primary care provider, a primary care learner, a pharmacy learner, what about metformin? You may have heard maybe metformin has lost its first place in the treatment of type 2 diabetes. You may be curious. I hope you each year do look at the updated standards of care that's released from the American Diabetes Association. Now, metformin certainly decreases the hepatic release of glucose. It also helps the body better utilize the insulin at the cellular level. And the primary side effect is nausea and diarrhea. It is an effective drug for lowering blood sugar. Now we understand diabetes to be more than just a blood sugar disease. We understand that it's on a cardiometabolic spectrum. So when determining the treatment for type 2 diabetes, glucose in and of itself is not always the primary reason that we choose the particular agent. Here on the screen, I actually have for you what is seen as our algorithm for 2023 for initiating treatment for type 2 diabetes. Here on the left, you're going to see what I call the green banner, which shows that looking at the cardiorenal aspects. So if you have a person with diabetes that you're treating that has atherosclerotic cardiovascular disease, or they're high risk for ASCVD, they have heart failure, or they have a chronic kidney disease, then either an SGLT2 inhibitor or a GLP-1 with proven cardiovascular renal benefits are your first choice because of the comorbidities. If you have another patient that you're going to initiate medication for type 2 diabetes that doesn't have ASCVD, they're not high risk for ASCVD, they don't have heart failure, they don't have chronic kidney disease, then you're going to decide, we move here to the right, is it going to be glycemic or weight management goals that are going to drive our choice? If a person's BMI is less than 25, their weight is probably somewhere, if it's in that normal range, it's below 25 BMI, then certainly metformin would be appropriate for that person along with lifestyle. You can see as you look further down this section that's outlined in the orange color that you look in terms of glucose lowering benefit. Metformin works, it does a good job. It doesn't have the greatest benefit. The medications with the greatest benefit include your dulaglutide, your semaglutide, and your tirzepatide. And then metformin does have benefit in terms of glycemic benefit, not as much as the ones I've just listed just a moment ago. If we move to the far right, this is for a person with type 2 diabetes that weight management is important. So the BMI is above 25. We want to treat the glucose, but we also want to lower the weight. So metformin is not going to be your first choice because it's not the most efficacious in terms of weight management. Looking here, if we scroll towards the bottom on the far right, we'll see that semaglutide and tirzepatide are your best choices in terms of lowering of the weight. So remember, metformin is no longer one size fits all for all persons newly diagnosed with type 2 diabetes. Rather, think in your mind, download that ADA Standards of Care app for your phone. It will walk you through this. And is it cardiorenal? If a person doesn't have cardiorenal disease, then it's either weight management or glycemic management that's going to drive the bus in what is your first line treatment. Stay tuned for more pieces from Reese's Pieces Diabetes.